So hello everyone viewers. So I want to ask you one question. Have you ever heard someone say he had a heart blockage and underwent angioplasty? But what actually happens in this procedure? Don't worry, I will explain it in the simplest way possible. We all know the heart is like a pump that never stops. The blood travels through the pipes called arteries and also veins, but mainly the arteries which carries the blood from the heart to different organs. But sometimes these pipes get clogged with fatty deposits called plaques. And this condition is known as coronary artery disease, also known as CAD. When blood flow is blocked, the heart muscles didn't get enough oxygen, and that's when people feel chest pain, shortness of breath, or even have a heart attack. Now, angioplasty is a procedure doctors use to open those blocked arteries and restore the smooth blood flow. So now in angioplasty, the procedure is first the preparation. The patient is awake but given a local anesthesia. Doctors usually insert a thin tube called a catheter through the groin or wrist artery. The catheter is guided carefully into the heart arteries using X-ray imaging. This is the second step, that is the guiding to the heart. A special dye is injected to see the blocked artery. Now at the blockage site, a teeny balloon at the tip of the catheter is inflated. This balloon squashes the fatty deposits against the artery wall, creating more space for blood to flow. To keep the artery open, doctors often place a small metal mesh tube called stent. Now, these stent stays inside permanently, acting like a scaffolding for the artery. The balloon is deflated and removed, but the stent remains in the place. Blood flow is restored and the patient often feel better almost immediately. Now, doctors usually recommend angioplasty if a patient has severe cardiac chest pain or during a heart attack when time is critical. The sooner the blocked artery is open, the better the chances of surviving heart muscle. Usually, before 2 hours, it's recommended to have angioplasty. Now, what are the benefits and also the risk of angioplasty? The pros about the angioplasty is that it relieves chest pain, improves the quality of life, reduces the risk of future heart attacks, is very important, and quick recovery compared to open heart surgery. I will talk about open heart surgery when it should be done in the coming video, also known as coronary bypass arterial grafting. Now, what are the risks involved in this angioplasty? First of all, one first risk is the bleeding at the insertion site, because we are inserting the catheter through radial artery or in the groin, mainly from the femoral artery, but there is a chance of bleeding. Other disadvantage is re-narrowing of artery. Remember, this is not a permanent thing. You have to take care of yourself. The person who have undergone angioplasty can again develop same severe cardiovascular disease again in future. And also a small chance of blood clots or heart attack during the procedure is also one of the risk factors. Now, what are the aftercare and the lifestyle that patient have to be followed after the angioplasty? Remember, angioplasty is not a magic cure. The stent keeps the artery open, but to stay healthy, patients must take the prescribed medicine. Normally, the blood thinners like heparin, and antiplatelet drugs should be taken by the person every day, and also eat healthy diet, exercise regularly, quit smoking, and manage the stress is very important. So angioplasty is like a plumber fixing a clogged pipe. Only here is the pipes of the life. Thanks for this procedure, millions of people around the world are living healthier and longer lives. So that was it in this video. And remember, take care of your heart and it will take care of you. So thank you so much.